Hi, I'm Adel Najdowski. Good afternoon. Thank you so much for joining me today for our monthly webinar through Skills, the monthly webinar series. Today I will be discussing the topic of providing effective behavioral parent training, wherein I will give a recap of the research of the last 20 years, as well as provide practice recommendations. In today's presentation, I will be first defining parent training and discussing its benefits. Then I will begin to summarize the research findings, as I said, from about the past 20 years. We'll then discuss practice recommendations, and throughout this I will also discuss areas for future research. So let's start by discussing what exactly is parent training. It has also been referred to as parent education, and it is basically programs that are designed to develop parent behavior that will hopefully promote positive outcomes in the parent's children. Behavioral parent training is something that has been found through research to be effective. It's been well researched for parents of children with autism, and this is something that is considered an essential part of applied behavior analysis intervention programs. There's many different benefits to providing parent training. Some of these include the fact that it's a cost-effective model of service delivery. It also contributes to the child's ongoing progress, which means that if the child's getting some sort of ABA intervention as it is, if now the parents are being trained, they can also work on things outside of the regular therapy sessions. This essentially provides around-the-clock intervention opportunities. So if we can actually get intervention for children during all times of day, that's going to be the best for these children. This also can lead to consistency of program implementation. So by having parents on board, we can ensure that what we're doing is remaining consistent across the child's day. This obviously can also lead to a greater potential for maintenance and generalization of effects, and it can improve the quality of the parent and child interactions overall, which essentially can lead to increased family access to social and leisure activities. So now once parents are trained, they can start to go about their normal lives again, doing things that they would like to do as a family, which overall will improve the quality of the family life. Now, in addition to all this, getting parent training can increase a parent's feelings of being competent as a parent, and this could eventually also lead into the parent feeling less stressed and possibly feeling fewer depressive symptoms. So as you see, there's a lot of potential benefits of providing behavioral parent training. So now we're going to discuss the research findings. And I'm going to start by looking at the topic, what have parents actually been trained to do within the research? And there's kind of like three main areas of research here. The first is that parents have been trained to be therapists with their children. So ABA is a treatment that's been shown to be effective, and usually this is provided by people with BCBAs, supervision is provided and all of that. But in certain cases, parents have actually been trained to implement the therapy. Parents have also been trained to use procedures that will lead to skill acquisition in their children with respect to very specific skills. And they've also been trained to deal with very specific challenging behaviors. So what I'm going to do in the next few slides is kind of show you specifically what kind of research has been done in these three topic areas. So we already know that intensive ABA, or applied behavior analysis type intervention, is effective. There's been repeatedly studies showing this. However, in addition to that, we know that there are obstacles that parents go through when it comes to securing ABA programs for their children. So for one, the demand far exceeds the supply of professionals that are available, especially with the current rise in autism. And oftentimes families, even if they can find a professional, might have difficulty with securing funding to be able to get the intervention. And when they can't get funding, then they can't even afford the intervention. So one possible solution for this that has been looked at is to train parents to actually deliver the ABA-based therapy directly to their children. A few studies have looked at this and have found gains in adaptive language as well as intellectual functioning in the children with autism that participated using this type of model. However, little is known right now about the long-term improvements and the effects on core deficits related to the autism diagnosis. So more research would be needed to really take a look at how does this affect children in the long run. Now, with respect to training parents to deliver interventions that are going to deal with them teaching specific skill sets to their children or skill acquisition, there's also been quite a few studies that have been published where parents have successfully been trained to implement certain procedures that will lead to teaching the children these skills. So let's look at some of the examples of the research that I found in doing my lit review. Parents have been trained to implement discrete trial teaching. So this is a little different than being trained as a therapist, because being trained as a therapist involves everything. But when doing intervention using ABA, there's other things besides discrete trials. A lot of times there's natural environment training, there may be precision teaching, those kind of things as well. So this is specifically parents just being trained on how to use discrete trial teaching, and it doesn't necessarily mean these parents are completely responsible for the treatment management of their children. There's also been research training parents to implement the Picture Exchange Communication System, also referred to as PECS program, with their children, as well as quite a few different studies teaching parents to implement naturalistic procedures for teaching language. So these come by a lot of different names, but some of the studies that have been looked at, you can see here, taught parents things like modified incidental teaching, just to name a few. So there's a few ideas here as to some of the naturalistic procedures that have been used. There's also been a few studies teaching parents to deliver ABA-based type treatments for teaching daily living skills. So anything from activity schedules or shopping all the way up through toileting and learning to wash your hands or put your shoes on. So some of these kind of studies have also been done, and parents have been trained successfully. And there's also been some studies training parents to deliver interventions that have to do with social and play skills. So for example, teaching parents to use script fading in order to get vocal initiations during play, or teaching them skills to get imitative play or joint attention. So these are just some of the examples in my lit review of some of the different skill sets that parents have been equipped with learning how to implement procedures with their children to gain these types of skills in the children that they are working with. Now let's look at challenging behavior. Along the same lines, in my review, I found parents have been trained to implement experimental functional analyses. So this means they are acting as the therapist in an experimental functional analysis, which is done to determine the function of the child's challenging behavior. They've also been trained to implement functional communication training, which is usually used to teach the child some sort of communication behavior that will take the place of the challenging behavior that they're engaging in. They've also been taught things like response blocking, and particularly for behaviors such as object mouthing, as well as have they been trained to implement procedures to deal with their children's sleep difficulties. In addition to these, they've been trained various techniques for dealing with their children's noncompliance, as well as many different techniques for dealing with their children's feeding problems. I found this interesting to see how many studies actually have been done teaching parents how to deal with their children's feeding problems, because this is an area that's pretty common in children with autism, and more studies are looking at that. So again, these are just some of the examples of where parents have successfully been trained to implement ABA-based procedures for tackling issues when it comes to their children's challenging behavior. I'm going to now switch gears a little bit. We've been talking about, what behaviors have parents been shown to be able to deal with through parent training, and we see it's been effective in many different situations. But now we're going to talk about the research that exists with respect to the service delivery model of parent training. And there's many different elements that are involved in a service delivery model for parent training that I'm going to discuss with you in the next few slides. So we're going to talk about trainer and parent characteristics, training settings, lengths and intensities, formats and procedures, procedural integrity, generalization and maintenance, as well as social validity and parental adherence. So we're going to start first about talking about the trainer characteristics. So from research, little is known about what trainer characteristics actually contribute to the best outcomes. And also very little is known from research about what level of knowledge is actually required of parent trainers. So one interesting study that came out by Ingersoll and Weiner in 2011, they actually trained teachers to deliver parent training, and they trained these teachers during a 2-day workshop. They found basically that parents improved their implementation of strategies, but they also found that there was still some room for improvement. And my take on it was, I kind of questioned this, that perhaps maybe because the teachers were only taught to be parent trainers across a 2-day workshop, that may have possibly contributed to why they found that parents could still improve. However, obviously, this is only one study, and more research would definitely be needed before any conclusions can really be made. So now let's talk about parent characteristics. Obviously, culture, socioeconomic status, and other family variables can possibly influence outcomes as to what happens with parent training, but really there's little to no research on this at all. In the research that I reviewed, I did find some information on mothers versus fathers. What was interesting is that most studies have trained mothers to implement procedures with their children. There has not been enough research yet to suggest that it even matters whether mothers or fathers are trained, but there have been a couple studies to give a little insight on this. NEEF in 1999 successfully trained 20 mothers and 6 fathers to teach skills to their children. Now, obviously, there were more mothers involved in this than fathers, but we see that the 6 that were trained did it successfully, whereas Sung and colleagues in 2006 actually found that it might be necessary to modify programs to accommodate fathers. For example, we may need more flexible scheduling, maybe to go around their work schedule, and maybe more flexible settings. So even maybe bringing the parent training to their office during breaks and things like that. So those are just some considerations when it comes to parent characteristics. Now let's discuss what the research says about the training setting. In reviewing the literature, parent training has basically been shown to be effective in multiple settings. So for example, it's been shown to be effective if it happens in a clinic. And in some cases, we've even seen the research showing that there's generalization to the home that has been found after parents have been trained in the clinic setting. It's also been found that parent training is effective when done in the home. And then there's this third model where maybe we do parent training in a clinic first, and then we follow this up in the home. Overall, the research doesn't show that there's one particular setting that's better than another, so that is unknown at this point. It just seems as though pretty good results have happened in all these different settings. Okay, so now we're going to move on and discuss the research on intensity and length of training. So intensity basically refers to hours of training per time period. So that would be something like if I was going to do training for 2 hours a week, or if I was going to do training in 25 hours, that would be my intensity. The length is the span of time over which the training is occurring. So that would be like if I'm going to do training for the next 3 months, or if I'm going to do it for a year or whatever. Now, current research actually can't suggest the optimal intensity or length of training. In reviewing all of the parent training research, I found basically that the delivery has varied greatly. It's been anywhere from parent training being delivered 1 hour per week, conducted across multiple weeks, to even seeing where they did 25 hours of training conducted in 1 week, just get it all over in one big bang. And what's interesting with those kind of studies is the reason that was done that way is because these families lived in geographically distant locations. So it wasn't possible to do training over extended length of time. Rather, they got the parents to commit to a really intense 25-hour training in 1 week, and then they were able to send the parents back to their location where they live. Training has also taken anywhere up to a year, and you kind of do it slowly because this is just part of the normal model, let's say, of just an additional thing that you're doing as part of your normal ABA program with a child. All right, so now we're going to talk about training formats. There's a lot of different formats. This first format that I'm going to discuss is self-directed formats. This would include things like books, DVDs, online programs, or other technology solutions. Some studies have actually supported the use of self-directed formats. So for example, Neft and colleagues in 2010 trained parents to use pivotal response training using an interactive 2-hour DVD and a manual, and they found success with that. Likewise, Zhang and colleagues in 2012 trained parents in knowledge of principles and procedures of ABA using the Institute for Behavioral Training's, which is also referred to IBT's, e-learning modules. So these are just a couple of studies and some examples where positive results were found using these self-directed methods. Now, others have found them to be either ineffective or to be less effective than in-person training. So for example, Young and colleagues in 2012 found only weak effects for 2 out of 5 parents who completed a self-directed package on discrete trial teaching, or DTT. So basically, my take on this is it's got to somewhat matter what is it that you're trying to teach in the self-directed format, and how good is the quality of the materials that you're doing in this format, and is it interactive at all? Are there tests for competencies built in, et cetera, et cetera. So I think there's probably a lot of variables that would go into play as to whether or not a self-directed format would work or not, and I think that's a huge area for future research where people can get in there and figure out, if we're going to use self-directed methods, what do we need to ensure that parents can actually do this successfully? Another training format that has been researched is this idea of group versus individual training. Parent training can be effective using either or a combination of these. So looking through the studies, most studies have been used, most studies used individual one-to-one training. However, some studies have used group combined with one-to-one, so they maybe meet for the group, they go over some basic concepts or touch upon concepts more generally speaking, and then they go out and work one-on-one with the families with actually implementing what they learned. And then there's been other studies that have done only group training, and these have been successful in some of these different formats. So again, there's not enough research to suggest whether group or one-to-one is superior. And there's also not enough research to suggest which components of group training are most important. I think that would be a good area for future research, is if we're going to use group training, what is the best way we can get the most out of this for these families? Another training format that's been looked at is something called the 3-tier model. It's basically like a training format that progresses from like a least to a most intensive amount of support that you're providing the parents. So in Tier 1, this is our least intensive one. This would be like a self-directed training model. Tier 2 would be like a group-based training model. So now I don't have to, it's not as much effort for me as a trainer because I can do it in groups. And then Tier 3 would be my most intensive, where I have to actually do one-on-one training. And basically the way the 3-tier model works is that families are assessed, and then based on what we find from the assessment, they will progress through each tier according to their specific needs. So we're going to kind of move around how they're progressing through tiers based on what happens in the assessment. So for example, some parents might actually skip tiers 1 and 2 and go straight to tier 3. And this would be like, if you can just tell this family is going to need one-to-one training, and you don't think they're going to get it from self-directed or group-based, you just go straight to tier 3. However, different kinds of families from the assessment, we might find that some might end at tier 2 if the one-to-one training is deemed unnecessary. So you may give them the self-directed and the group-based and then call it a day because they're getting really great results already. Like everything else so far, more research on this model is needed before the efficacy, the effectiveness, and the cost efficiency of it can actually be determined. Another format is referred to as the pyramidal model, which is also known as the train-the-trainer model. This measures the extent to which trainers are able to train other care providers. So usually they're going to be training another family member, or maybe even like some sort of a professional that's involved with them. Simon in 2005 trained parents in the pivotal response training, and those parents then successfully trained other care providers. And then Neef in 1995 trained parents who trained parents who trained parents various skills. So what I mean by that is they trained one group of parents, that group then went and trained another group of parents, and interestingly enough, that second group was able to go and train a third group of parents. Now that's really cool, because basically the potential benefits here are very wide. The spread of effect becomes larger and larger. We're able to impact more and more people through that kind of model if it can actually be done right. It obviously is going to enhance cost efficiency and support and provide a support network for parents. It allows them to train each other and to learn from one another, which obviously helps with support of friendships and everything else. And it allows for maintenance of skills learned by the parents who become trainers, because we know that in order for someone to truly understand the things they're being trained in, the best way to know they get it is if they can train someone else, not if they can just talk about it or if they can implement it. But being able to train another person means you really get it. This seems like a promising option for families that are especially in geographically distant areas because it allows families to get trained and then go train other families that are local to them. Okay, now we're going to shift gears and talk about training procedures. So what do I mean by training procedures is if I'm training families or parents on how to teach skills or deal with challenging behavior, what methods am I using to train them? A large sample of studies have used multi-component treatment packages or training packages, including 3 or more of the following. So in training parents, it's usually included 3 or more of these things. Didactic instruction, which could include verbal instructions to the parents on what to do, or written instructions to the parents on what to do. That could be a manual they read, or even just an instruction sheet. Also modeling, so showing the parents what to do with their child. Either it can be done live or it can be done via video modeling. And rehearsal, this is where parents basically role play with either the trainer, so the trainer might pretend to be the child and the parent practices doing what they're supposed to do with the trainer being the child, or they could go directly and rehearse it with their child, in which case the final component is feedback, where the trainer is going to provide feedback to the parents. And this is going to usually include positive feedback for when the parent does the right thing and corrective feedback for when the parent makes an error. Only a few studies have actually evaluated individual components of training packages. So from what the research suggests, written instructions alone are usually ineffective. And because of this, they're sometimes being included to demonstrate baseline performance. So in a few studies that I've seen, they actually during baseline provide the parents with written instructions, and then they collect data to see if the parents can do it, and they show they can't. And so that's why it's the baseline. And then they implement treatment, and now they begin to give more components of the training. So that could be the feedback and the other things. Now, the research looking at written instruction combined with verbal instruction has actually shown mixed results. So, for example, Mueller and colleagues in 2003 found that verbal and written instruction, they found when using this, it was as effective as packages containing more components than this. So they were showing, wow, I only need to use verbal and written instruction. I don't need necessarily the rehearsal and the feedback and all this other stuff. But Lerman and colleagues in 2007 found parents receiving verbal and written instructions demonstrated accuracy, but only on some skills, and that feedback was needed to learn the remaining skills. And then Urbis 2010 found that written and verbal instructions combined with feedback, so now we're adding feedback into this, was better than written and verbal instructions alone. Now granted, this study did not include necessarily children with autism only, so there was also kids with developmental disabilities in this study. So overall, what this kind of suggests is that it kind of depends if you need, if written and verbal instruction alone will be good enough. And I'm sure there's many different variables that can contribute to whether or not this is going to work. It could be even things like how complex is the procedure and that kind of stuff. There actually is not enough research right now to conclude which components promote success, and I think that there's potential variables that could contribute to the effectiveness of different training components. So like I said, type of skill being taught. If it's a really difficult thing for them to learn, it's going to be possibly impact what kind of procedures are going to work for training them. What about the complexity of the protocol? If you put together something for the parent to do that has so many different things they have to remember, are they going to be able to do it? If we keep it simple with the intervention we teach them to use, maybe that'll make a difference. Also, whether parents have had previous training. So have parents already been watching ABA for the last 3 years go on and they kind of get it and they've been trained kind of along the way and understand it for the most part? Or have they even had previous parent training before and now they're kind of just brushing up on their skills? Also, what about the parent motivation and their stress and depression and income and education and reading levels? I would think all of these things would impact what you need to include in a training package for the procedures you're going to use to train the parents. So future research questions on this would be which treatment methods are actually necessary and which variables are associated with the success or failure of particular methods. Those are some wide open areas for future researchers. Now, There's one potential model that has been discussed by Lerman and colleagues for identifying required and sufficient components. So this is kind of an interesting model that really makes sense to me. Perhaps you want to start with the easiest and the least expensive method first, like written instructions with the parents, then immediately evaluate their performance. If they're not getting it or doing well, then add supplemental instructions only for the incorrectly implemented procedures, in which case then you would evaluate performance again and continue to add more items into the training package until they're getting it. That's one particularly potential model here. Okay, now I'm switching gears to discuss with you procedural integrity data and what the research shows on that. Many studies haven't actually collected procedural integrity data, which is really kind of shocking to me because if you think about it, you're training parents to go out and deliver interventions for children. Wouldn't you want to make sure that they're doing it with procedural integrity? Wouldn't you want to take data on how accurately they're implementing the procedures? Because isn't the goal here for the child to actually make gains? And I would think the parent needs to be implementing it correctly in order to make those gains. But that said, when procedural integrity data have been included and measured, they've been measured through either direct observation or through videotape sessions, and sometimes a combination of these two things. In studies that have reported procedural integrity data, they have shown it to be high, which is good and promising. But future research on this, I think, should definitely include this measure. And they should probably also look to determine if it's related at all to child outcomes. So does it matter if the parents implement the procedures correctly or not? Maybe it doesn't. Maybe I'm kind of missing the picture here. I don't know. So that's something for future research to determine. Now, what about the research on generalization? A few studies have actually included complete information about generalization, but generalization has actually been measured and observed across settings and stimuli, both for parent behavior. So we're teaching parents skills and we're seeing, oh wow, they're generalizing these to different settings and with different stimuli. That's cool. We're also seeing some generalization in child behavior. So the parent now is implementing something with their child, and wow, the child's not just doing it in one setting, but they're doing it in multiple settings and they're doing it with different stimuli. So that's great. So some research has shown generalization has occurred when parent training has been implemented. However, there's also been some research showing limited generalization in different cases. So it doesn't look like you're going to be guaranteed, I guess, generalization if you do parent training. So again, this is probably something that needs to be measured and tracked, and people need to program for it. Now, like generalization, maintenance as well, few studies have included complete information about this, but the studies that have measured it have oftentimes shown maintenance to have occurred and be observed several weeks to even 1 year post-training, both, again, for the parent behavior. So the parents are continuing to implement the procedures that they've learned for longer periods, which is great. And the child's behavior has continued to maintain in the positive direction that was achieved during the parent training. However, again, like generalization, in some cases, lower levels of responding were found during maintenance for parent behavior and child behavior. So we're not always seeing maintenance. It's sometimes and other times not. And so again, this is something that will need to be programmed for and probably measured in parent training programs. Now, the research on social validity. Many studies have not included measurement of social validity, and there's oftentimes methodological weaknesses in how acceptability is evaluated. But for the studies that have actually collected social validity data, parents have generally reported being pretty satisfied with the training that they've received. And a very cool outcome, Neft and colleagues in 2010 also collected data on parent confidence ratings. So they actually asked parents, how confident do you feel during your parent-child interactions now that you've received parent training? And they found an increase. So parents were verbally reporting that they felt a lot more confident. Now, whether or not there was major changes or anything is a whole other story, but it's good to know you can make a parent feel more confident, because hopefully that leads to less stress for them as well. Now, with respect to the data and the research on adherence, so what I'm talking about here is parents adhering to and complying with the procedures that you give them. Now, in parent training, compliance issues are pretty common. There's little research examining methods for improving adherence, and the studies that have examined this have not necessarily involved children with autism. So I decided, you know what, I'm going to go ahead and include these studies anyways, because if I don't, then I won't have anything to say on this. And I think that we could use some of these ideas with children with autism even though they haven't been used in that population. So let's take a look at some of the things that people have done. There's been some different strategies for increasing adherence to parent training protocols. So one is making training contingent on submitting data. Another is making training contingent on completing assignments. Another is providing tangible reinforcement in the form of, let's say, gift cards for completing requirements. And a final is implementing a response cost contract. So basically making the parents sign a contract that just says, I'm going to lose a monetary deposit if I miss parent training meetings, if I fail to collect data, or if my child doesn't achieve their behavioral goals. And so different studies have shown these methods to be effective for getting parents to comply with the procedures that they're taught. However, here's the kicker. Because these procedures were often one component of an entire parent training program and they weren't actually the main variable that was being measured, they didn't measure like the outcome of using these procedures to see does it increase adherence or not. The effects on adherence are actually unknown. So that wasn't the point of these studies oftentimes, and so we don't really know. Only a few studies have actually measured child outcomes in relation to parental adherence. So for example, Murr and Milan in 1982 found that delivering lottery tickets contingent upon child progress actually increased parent practices. And Sapo in 1979 found that training parents in self-management, so they had to actually keep track of what and report on what they've been doing and all that kind of stuff, or providing social reinforcement, so telling them like good job and all that kind of stuff, produced greater improvement in child behavior than when they were not used. And interestingly, they also found that when both self-management and social reinforcement were combined, there were even greater improvements. Okay, so now we're going to shift gears, and based on all the research that I just presented, I'm going to discuss practice recommendations. So what can we take away from the research that I've just reviewed, and what can we put into place now to try to improve or to use best practices, I would say, for parent training? And I'm going to first discuss buy-in and adherence because I think this is like the key to everything else. Everything I'm going to talk about, you have to get buy-in from the parents, and there's always some sort of collaborating and negotiating and compromising with parents that needs to go on in order to ensure success and make them feel like they're a real part of the parent training process. So let's talk about that first. Preliminary findings of studies, as I said when I reviewed the research, implementing contingencies to increase adherence seem promising, I think. So trainers might want to actually use some of these strategies with parents. Additionally, though, trainers should consider variables that compromise buy-in, and they should probably think about implementing either adaptations, maybe some additional support strategies, I'll talk about some of those later, as well as some accommodations. And we talked about earlier things like doing it in the settings that they would prefer, like if they would want the clinic or if they prefer at home or if they want you to come to their office or whatever. Also, collaborative and supportive trainer-parent relationships may play an important role in adherence. If the parent feels like they're a part of the team, they're going to probably buy into it and they're going to feel like they own it and be more likely to comply. So what I would suggest is combining confident behavioral training skills with rapport building skills, such as warmth, empathy, and humor. It's probably important to do this because it helps to build a rapport. Now, beyond rapport building, there's other challenges that might contribute to struggles with compliance. So you're going to have, at times, you're going to have a lot of other things going on. Single parents, low-income parents, or parents with lower educational status. Now, these kind of families might be likely to have less time and resources, and they might be feeling more isolated or lack social support or even feel more stressed or depressed. So consider the fact that just because you build a good rapport doesn't mean they're going to be able to still adhere. Because until basic needs are being accommodated, it's unlikely parents are going to be able to fully participate and benefit from the parent training program. Thus, you're going to need to address a family's broader needs and develop other sources of support for them. And implementing strategies are likely going to hopefully increase social validity. So, let's talk about child target behaviors and goals. How do you choose as a parent trainer what you're going to teach the parents to focus on? What target behaviors and goals do we have for the child? Well, early stages of parent training involve determining this, and there's many variables that might impact treatment outcomes, such as the child's age, Sometimes if they're younger, it might be easier to implement certain things. Previous treatment, if they've had previous treatment, they might be used to already complying and responding to ABA-based type interventions. The child's acquisition rate and level of functioning, if they're a very quick learner, that will definitely impact what kind of methods you're using versus if they're not, and also the severity of the problem. Now, it's critical to consult closely with the parents to identify their needs and their priorities, and you may simply just ask them, what do you want to work on with your child? What's really important to you? Pick your top 3 things that you want to accomplish in our parent training. Collaboration of this sort might reduce the parent stress and also improve their buy-in. And another big thing here is that you should probably assess the parents' expectations about the training and the intervention. So find out, what do they think is going to happen when you provide this parent training, and what do they think is going to be the outcome of it? Because if their expectations are too high, then they're not going to feel like it was worthwhile. You might have to help them to lower their expectations a little bit, or to come up with realistic expectations and those sorts of things. All right, so what does the research tell us about what interventions to teach parents? So we figured out our goals. We know what things we want the parents know what things they want to work on for their child, what they want to improve, and then now we have to decide, okay, so I'm going to help the parent to increase, maybe let's say, the child's social communication. I have a lot of options about what procedures I could use for that. A lot of different naturalistic teaching procedures, etc. So this is now the time, once goals have been selected, to figure out what interventions are going to be used. So in doing this, it's necessary to think about the family and choose interventions that parents feel comfortable with and that they're likely to adhere to. So you can give them options and tell them, here's how we could treat this behavior. We have option A or B. Do either of these sound something, do you feel more comfortable with one or the other? You're going to want to choose things that are responsive to the values and the goals of the parents. What's interesting is that sometimes the things we ask parents to do don't actually mesh well with their overall philosophy on life, or the way their values about raising children and things like that. So it has to be considered. You might also want to use the parents' previous experience, their knowledge or skills that they already are presenting with, so that they can be set up for success. And you should probably think about choosing interventions that are compatible with the family's typical routines and culture. Culture is a big thing that's very important to also consider. So if you design a program that's compatible with the family's daily life, this will ensure higher procedural integrity, hopefully, be truly meaningful for families, and ensure good contextual fit. Mose and Freya in 2002 found that parents rated the sustainability of intervention higher, and greater gains were made when family context was addressed. So rather than coming up with your interventions in a vacuum and saying, okay, well, the research says it always works if we use this intervention to teach this type of skill, that's what I'm going to have the parents do. Instead of doing that, looking at the family context and figuring out something that will fit into their world, supposedly is something that parents rate. They're going to be able to sustain this for longer. That totally makes sense. And interestingly, greater gains have been found. So definitely important to do that. Now, also when choosing your interventions, though, you're going to want to choose interventions, obviously, with empirical support. So you're not just going to choose things randomly. It's going to be stuff that has been shown to be effective in the literature as being able to teach certain skills or reduce challenging behaviors in children with autism. Now, interestingly, though, there isn't a lot of research looking at whether or not interventions are work when they're implemented by parents or not. We know a lot about what interventions are effective to teach certain skills in ABA, but that doesn't necessarily mean parents were the ones implementing them. There have, however, been a few comparison studies where these researchers have compared teaching the parents maybe like 2 different procedures to teach the same skill in their child, and looking to see which one had the best effect. So it's kind of an interesting line of research. Charlotte, Christie, and Carpenter in 2012 found that parent-implemented modified incidental teaching resulted in better acquisition of target phrases than using incidental teaching and discrete trial teaching. So they actually taught parents those 2 things and then found one worked better than the other. Yoder and Stone in 2006 found PECS was more successful in increasing spoken communication in child participants than responsive education and pre-linguistic milieu teaching. Now remember, all these studies were done with parents, these ones that I'm telling you about right now. And then Smith and Lerman in 1999 found that guided compliance led to better child compliance than when parents were trained to use high probability instructional sequences. So there might be something to this, that perhaps training parents to use certain procedures will work better than others. And this is just something that there's very little research on right now. Now, also when choosing your interventions, choose ones that will be supported by real-life contingencies. So for the most part, it seems as though naturalistic teaching procedures might be well suited for this because they're easy to individualize and fit into the family's routines. They may possibly result in lower levels of stress for the parents because of that. It doesn't feel like you're adding too much on top of what they already have to deal with. It could create multiple learning opportunities throughout a day and possibly promote generalization. And it may even speed up treatment gains and produce less problem behavior compared to more structured drill and practice type methods. So just something to consider. Let's make this as natural as we can for the parents and just something that they learn to do every day in every interaction instead of an individualized teaching session where the parent has to go and sit down with the child and teach them something right now, because that kind of increases the response effort on the part of the parents, doesn't it? Trainer characteristics. Let's talk about that for a minute. Well, we know clinicians are typically trained to design interventions. They're not necessarily trained how to be parent trainers. That's interesting, right? Being skilled in implementation doesn't mean you're going to be able to train someone else to do it. So trainers must learn to deliver both reinforcement as well as provide corrective feedback to parents in ways that motivate them. So they need to learn to implement the exact same principles that they do with the children they work with, but they need to do them with the parents. Make sure the parents are getting feedback and that they're getting reinforcement for what they're doing. Otherwise, they're not going to want to continue. Trainers must also emphasize collaborative approaches and have well-developed rapport building and empathy skills. So these are all things that will probably be pretty important in a trainer in order for them to be successful. Now, what about parent characteristics? Well, obviously, we're going to have to identify who are we going to train. And if we can train both parents, that would be awesome because it will lead hopefully to more consistency and possibly better generalization. However, that can't always work. In fact, if you have a working parent, then you probably would be better off training the non-working parent because by default they spend more time with the child than the other parent. Also, consider the fact that there may be other family members living in the house who spend a lot of time with the child or particularly not working as well, like maybe a grandmother or a grandfather. Maybe they need to also be trained. Other considerations with respect to parent characteristics, though, is you got to think about the fact that there might be differences in parental approaches. And that means that basically one family's approach to parenting might be a little different than another, and so that might tweak how you would do things. Also, different strategies might be implemented if you're training a father versus a mother. You've got to think about what they're going to feel comfortable with. Their educational backgrounds matter, so keep materials at their reading level. And finally, cultural variables are also important to consider when developing your parent training. Historically, culture and ethnicity has been pretty much ignored. There's not really any research addressing the influence of culture on training success for parents of children with autism, and it has been suggested that ignoring these factors could actually hinder success. So trainers should be aware and sensitive to the cultural attitudes and parenting practices, and they should also make sure that they're aware of their own cultural biases that may become a barrier to effective training. And overall, trainers should be flexible and use an individualized approach, realizing this will be the best for the families because it ensures that they have a trainer that is on their same or thinking about their needs. So for example, maybe they need to make sure that they have someone to train them who speaks their same language and those kind of things. It's going to make the family feel a lot more comfortable. Okay, moving on to training setting. From the research, it's unclear right now whether training in the clinic versus home is superior. So all I can really do is talk about some advantages and disadvantages of each. So for the clinic setting, one advantage is it's a more controlled environment and you'll have fewer distractions for establishing new skills. And a few studies have shown that there's been some generalization to the home. Now, with respect to the home setting, there's an advantage of the fact that it more closely matches the real world of the family, and thus it might result in more rapid acquisition and possibly better generalization for both parents and child behaviors. It also, by doing it in the home, could potentially improve attendance. So this is especially for families who don't have a vehicle, or for whom it's difficult for them to come to you for training. And we might find that there's just some skills that if those are the targets, they're going to be better suited to be done in a home setting. So for example, if I'm doing toilet training, I'm probably going to be better off doing that in a home setting. How about intensity and length of training? Overall, the optimal intensity and length of training is pretty much unclear from the research, and I'm guessing that different intensities and lengths will be successful under different conditions, and research needs to be done to figure out what those may be. Some relevant factors, though, that should be looked at when it comes to designing your intensity and your length of training would be ask the family how much time do they have to devote to the training, and consider that individual training would allow you to possibly be more accommodating for the family in terms of how many weeks and how many hours per week than group, because obviously group training is pretty much set up already and they need to fit into the mold as opposed to you fitting into their schedule. And realize that flexibility with scheduling and or reducing time commitments might actually increase parental adherence, so that's something to consider. Maybe being a little more flexible and not being totally stuck on how many hours a week you're going to require or whatever. Group versus individual training. It's unclear right now whether group versus individual is superior, so this is something you'll probably need to individualize on a case-by-case basis. There's a lot of advantages of using a one-to-one or an individual format. It allows a high degree of individualization, obviously. You can schedule your training around the family routines, which will hopefully increase attendance. And the content of what you're training them on can be tailored to their very specific needs. It can also be done in a variety of settings, which may aid their generalization. So if you're doing one-to-one, you could, meet in community locations and things like that if you're teaching those kind of skills. It also could allow for greater focus on providing practice with feedback. So if I'm doing individual training, I have the opportunity to give feedback much more often than I would in a group training setting. However, there's also some advantages of group format. For one, it's more cost-effective and time-efficient as you can train more families at once. And this is also a really good option for people that are in remote areas because they can travel to come to a training and then go back home. And group training also can possibly facilitate mutual support amongst the parents, and that could eventually maybe lead to a decrease in parent stress because now they've met all these other people who are going through the same things that they are going through. Okay, so what can we say for practice recommendations on what procedures to use to train families? Well, we do know that multi-component packages work, but we don't really know what components are necessary. It does appear, though, that written instruction alone is inadequate and that feedback plays an important role. So my suggestion would be use as few procedures as necessary to get your desired results, but it's probably reasonable to assume procedures should at least include feedback and something more than written instructions. This is obviously unless you're maybe using like a manualized self-directed program. With respect to procedural integrity, no studies have actually specifically examined the relationship between procedural integrity and outcomes. Presumably, though, high procedural integrity would probably contribute to the effectiveness. So I would suggest training parents to high levels of procedural integrity and continuously monitoring the parent's performance. And when you find that procedural integrity is low, you should adjust your training protocol and provide more training. And if in the case you find procedural integrity is high but the child's behavior is not improving, then at that point you know you need to make changes to your intervention, that it doesn't have anything to do with the parent's procedural integrity, it's just the intervention you're using with the child that may not be working. Now, with respect to generalization, I think this is something you have to program for. It's not going to be something you just hope occurs. So throughout training, you're going to want to make sure that parents are taught multiple exemplars, but also that they use multiple exemplars with their children, and that this is happening in many different settings. And in one case, Steibel in 1999 taught parents to use problem-solving skills, which I think is pretty clever. They taught parents to basically problem-solve when certain outcomes weren't being achieved. And if you want more ideas on what you could do to ensure generalization, I would say take a look at Stokes and Bear in 1977 for a detailed discussion on how you can facilitate generalization. And then last, if generalization is not occurring, it's going to be necessary to add strategies to absolutely promote it. And this should probably just be something that is just standard anyways. Just plan to add strategies to begin with to ensure that you get it. With respect to maintenance, I would suggest choosing functional skills that will be supported. So if you want the change in the child to maintain and you want the parents to be able to continue to implement these things after the parent training is over with, choose functional things that will be supported in their natural world. There has been one potential method for increasing maintenance of parent behavior that has been looked at, and it involves training spouses to give each other feedback. So Harris and colleagues in 1998 did this, and this method was actually found to improve or sustain performance for 5 of 6 parents for up to 6 months. So that's pretty interesting, and I think that's a cool thing that maybe more research should be done on, or people should try, because that could be pretty promising. You're also going to want to measure maintenance for as long as is necessary to ensure meaningful and long-lasting results. I've seen many studies that measure maintenance maybe 1, 2, or 3 week follow-up. Well, I don't know if that's really good enough. I don't even know if 1 month follow-up or 3 month follow-up is good enough. I know it's harder to do that kind of research, but we need to make sure that if we're doing this, we're not wasting anybody's time in the long run. We want to make sure these changes maintain for the long term. And if during our follow-up we find that the behavior has worsened, we're going to need to provide booster sessions, right, to make sure it gets back up to speed. Now, you can also see Cooper, Heron, and Hewer 2007 for some guiding principles with respect to maintenance as well. So parent stress. Well, we know stress may impede parents' ability to benefit from parent training, and it's sad, but parents have reported that their sense of crisis can feel relentless and that they often feel unsupported and frustrated. Parent training can actually decrease stress if it's done right, but you know what? It can also increase stress. So if I don't do it right and I don't consider their culture and make adaptations for them, and I don't come up with protocols that are at their reading level, and I don't ask them what's important to them and all these kind of things, but I just throw something on them and say, here you go, this is what you're doing, I'm going to probably end up increasing their stress. But if I do it right, I might actually decrease their stress. It can also be insufficient to increase parent adjustment if the stressors are chronic. So if parents have chronic stress, even if you do really good parent training, there's a chance they're just not going to be able to do it. So it's going to be necessary to design programs that fit into the family's daily routine. And you should also identify additional sources of support. This may be peer or social support. There's actually some research to suggest parents that are concurrently enrolled in a support group are more likely to master techniques. You might also want to suggest to them where they can go for counseling, where they can get respite care, where they can get legal advice, etc., etc. So keep your referrals close and refer them to good people when you find out about them, because in addition to what they're getting from you, but there's so many other supports out there that they could be taking advantage of. And if you have parents that are just chronically stressed and they cannot deal with all of that, then another option to them that you might want to suggest is acceptance commitment therapy. This is a scientifically based approach that is potentially useful where problems are chronic, stressful, or not easily corrected. What ACT does is it emphasizes acceptance of unpleasant emotions. It helps parents to diffuse from their very difficult thoughts, because they're oftentimes having very difficult thoughts about their children and their situations. It helps them to clarify what their personal values and goals are, and it helps them to come up with what are the effective actions that I need to engage in to reach these goals. And overall, ACT therapy may help parents to adjust to their difficulties in their life, increase their positive parenting interactions, and even potentially decrease child behavior problems. So if you are working with a family that's really seeming to be struggling with just the emotional stuff they're going through and the difficult thoughts about it, I would definitely not hesitate to suggest ACT therapy to them as something that they may want to take advantage of. So just to recap on today's presentation, I'm about to wrap up here. We know parent training is a critical component of effective intervention, and with the rise in autism, more need for evidence-based and cost-effective parent training is needed. The focus on parent training is usually on giving them procedures to deal with the core symptoms of autism, so teaching them things to deal with social communication deficits or challenging behavior in their children. And we found through looking at the research that different teaching formats, modes of service delivery, settings, intensities, lengths, content areas, and techniques have been shown to be effective. Trainers need to be held accountable for ensuring high procedural integrity and generalization and maintenance, and its individualization of programs is going to be essential for ensuring parents stay committed and continue to use the taught skills while resulting in the long-term positive outcomes for the family as a whole. So trainers should definitely identify any variables that could affect outcomes, including stress and other mental health issues, parent expectations, cultural and socioeconomic factors, as well as family structure. And so I thank you so much, and I actually have a little bit of time to answer some questions, so I'm going to take a look here and see what questions are coming through. Okay, so my first question says, when training parents, do you have any thought on how to introduce the steps of what they are being trained to do? For example, if they are being trained to be therapists, they have to learn an overwhelming amount of information. So if there's a lot of information, basically, is what they're saying that the parent needs to learn, how do I get that information across to the parent? Do I teach all of it at once, or is there some other way? And that's a really good question that needs to be researched before really solid conclusions can be made in terms of what the recommendation would be. But I can tell you that I have heard of models before. I don't know that there's necessarily any research on this, but where you would get the parents involved and throughout you would maybe show them everything it is they're going to be doing, but you do it all, and they just kind of watch. And then from there, now they're done doing that, so they understand, okay, I'm going to be doing all that. And then the next day, you have them do one component and you do everything else. And then maybe after that, once they're showing proficiency at this one component, you add on more components, and you slowly add on components that the parent's taking over and you're no longer doing, and you're giving more and more control to the parent while you're releasing more and more of the control from yourself. That would be one possibility that you could do if you're feeling that it's a little overwhelming, to just get them in there and train them on everything from the start. So very good question. Thank you. Another question I have says, I'm looking for self-directed e-learning to recommend to parents. Can you tell me more about the Institute for Behavioral Training's modules? What do they teach? That's a good question too. Thanks for asking. They have, I believe that they have all sorts of e-learnings now. The last time I checked, I think they had e-learnings for parents specifically, but also for other populations. The kind of things that they teach to the parents are like general information about, exactly what autism is, what ABA is, different procedures for how you teach skills to children using ABA techniques and principles. So they teach them things like how to implement shaping, chaining, how to do discrete trial teaching, how to actually evaluate your child to see if they're learning through collection of data, and how to make sure you're getting maintenance and generalization. So basically, like everything you would need to know to have a really good ABA program, basically. All that kind of stuff is in there. And they may have even added more since the last time I checked, but for the most part, it would be anything they need to know to be able to even just do an ABA-based therapy program for their child. Okay, question 3 says, I am working with a family that I think could benefit from the acceptance commitment therapy. Can you tell me what resources I can give them? Okay, so that's a very good question too. Thank you for that. Let me think here. There is a website they can go to. Contextualscience.org. Contextualscience.org. They can go there, and I think they can look up through a directory for an ACT therapist in their area by maybe typing in their zip code or something like that. So that's one way they can go and try to find an ACT therapist. Or you could do that, and then you could tell them what ACT therapists are in their area. There's probably also many ACT workshops and things that they might even be able to find out through that website and sign up for. But there's also books. So one book that was specifically written for parents is called The Joy of Parenting, and I don't remember all the authors, but the main author, or first author, I think is Lisa Coyne, and it's spelled C-O-Y-N-E. There's another 2 books that are really good by Russ Harris. One's called The Reality Slap. Russ Harris is actually an ACT therapist, but he's also an MD, and he has I believe, a child with autism, and he writes about what that's like as a parent and what happens for a parent, but he also provides tons of strategies or whatever for dealing with it. And then he also wrote another really good book that's just generally about ACT and very helpful for anybody, called The Happiness Trap. So that is what is this? Yeah, Russ Harris. So check out those books and that website, and hopefully you'll be able to learn quite a bit for your families through that. And actually, that is all we have time for today for questions. Thank you so much for attending today's webinar. Please know that this webinar will be available to you in the future on the Skills YouTube channel, and we hope to see you again in future webinars. Take care.